Hello, my name is Dr. Stephen Katz. I have been a practicing dentist for 40 years. For the last 15 years, I have been coaching practices to success. One of the things that I frequently see is doctors presenting treatment and then patients showing some forms of objections in the way of questions. A lot of doctors will feel that when a patient asks a question, they do not want the treatment. But actually, when a patient is asking questions, it shows that they do want the treatment, but they have some sort of obstacle in their own life that they need help in overcoming. The five most common objections that come up to treatment are cost, fear, time, sense of urgency, and trust. The question that's going to come up most frequently, besides cost, is one of urgency. And that is the one that we hear whenever a doctor leaves the room and the patient asks either the hygienist, the assistant, or the administrator, do I really need that treatment? Do I really need that crown? Could I do something less expensive? Could I wait? Could I not do it at all? Really, do I really need it? That's the essence of it. And this is where the skill feel, felt, found that I spoke about before really works extremely well. When you say, Mrs. Jones, I understand how you feel, that is validating what they are going through in their mind. The second part, other patients have felt the same way and have asked the same question. Our patients are all of a personality type. Most of them, 80% of them, are people-oriented and introverted. And what's extremely important to them is feeling that they're part of a community, a group, a family. Belonging is so important. So when we validate it by saying other patients have felt the same way, they don't feel like a freak or an outlier, it's very comforting to them. The found part is where we help to not sell them, but to guide them into making a better decision for themselves. Mrs. Jones, I understand how you feel. Other patients in our practice have felt the same way and asked the same question. Those patients that followed our recommendations have usually found that the treatment goes easier, the cost of the treatment is less, the discomfort is kept to a minimum, and the results are much better. The patients who hold off for one reason or another oftentimes find that the treatment is more difficult, the cost may be greater, the fees are higher, it may be more uncomfortable during the course of it, and the results may not be as good. Which one makes sense to you? And that enables a patient to look at the options and say, I see why the recommendations are best for me, and that really should be the way that I go. Another one that may come up is trust, and that particularly for some of the younger doctors. Trust questions come up when a patient says, is that something you normally do? Is that something you've done before? Do we have any assurance that something like this is going to work? One of the best tools in overcoming a trust question is asking a patient, would it be helpful to them to speak to another patient who has recently had the same type of treatment done and can tell them about a great experience? Now, I'm not saying that we're going to put patients in touch with every patient that we've ever treated, but when you offer that to somebody, 9 out of 10 will say, no, that's okay. The fact that you're offering that, I have greater confidence. Let's go ahead. But for the 1 out of 10 who say that that contact would be important, isn't it amazing if you can now ask your administrator to get one of those patients on the phone so when your patient is presenting to the administrative desk to check out, they can say, Mrs. Jones, would it be helpful for you to speak to that patient that Dr. Katz was talking about in the treatment room? I actually have them on the phone now if you'd like to speak. And that is a real wow to a patient and a slam dunk for them in going forward with the procedures. So as you can see, all of these objections can be turned into opportunities that enable a patient to go ahead with treatment if you handle them in a scripted and predictable way. I hope that has helped all of you in coming to a new realization that patient objections are an opportunity. And I hope that this will help you and help in overcoming what seem to be the blockages to going forward with treatment. And I hope that will help you become more successful in gaining treatment acceptance.